Mike, MERS has already killed about 1,200 people worldwide since it was identified about 3 years ago. The good news is that MERS is not easily spread. Unfortunately, it tends to strike people who are already sick and have weakened immune systems.
The scientific name of the virus is Middle East Respiratory Syndrome Coronavirus, better known as MERS. It was first identified in Saudi Arabia in 2012. It's part of the same family as the common cold and SARS, and is spread through close person-to-person contact, often in hospitals, where cultural differences may make hospitals in Asia more susceptible to outbreaks.
The reason for the outbreak primarily initially was because of patient and family member or guardian culture. On the multi-bed wards, there is a fundamental difference from the West, and that is family members come in and provide care.
MERS has a 2-week incubation period and kills about a third of the patients who contract it. It causes fever, pneumonia, and kidney failure. There is currently no vaccine, but researchers are hopeful that will soon change.
We were presented at the recent technical meetings in the Middle East on MERS developments about promising trials with new vaccines.
Without a specific treatment, public health officials focus on identifying people who may have been exposed and placing them in quarantine.
I think one of the important actions to take will be to invest more in strengthening the public health and the health system in the country.
In Saudi Arabia, MERS is often spread from camels to humans. Researchers say they're getting closer to a vaccine for the camels to stop that method of transmissions. Researchers believe the virus initially spread from bats to camels and then to humans, Mike.
That's fascinating to see how these things spread. Let's talk about the doctors, the nurses there. What kind of precautionary steps are they taking? They must be doing something.
Yeah, healthcare workers are some of the most at-risk people for contracting MERS. The precautions they take are somewhat similar to those we learned about for Ebola. First, screening patients who may have been exposed to somebody with MERS, then isolating those patients while ensuring that those healthcare workers have limited contact with sick patients. Gloves, gowns, respiratory masks, all things we saw with Ebola. And then the screening period continues for that 2-week incubation period. Fascinating, Mike, the 14th patient, patient number 14, spread MERS to 60 of these 130-some cases. They call that person a super spreader. The 2-week incubation period for contacts with the super spreader ended on Friday. They hope that is going to be a really significant part of them moving forward on this.
Yeah, and